This podcast represents my opinion and the opinion of my guests. This is not medical advice, and I am not establishing a patient-physician relationship with any listener. The content here should not be taken as medical advice. The content here is for informational purposes only. And because each patient is so unique, please consult your healthcare professional for any medical questions you may have.
Welcome back, everybody, to another episode of the Not Your Doc podcast. I'm your host, Vanessa, and I'm here again with our producer, Seth. We are in the Midwest Institute for Hearts and Minds studios here in Dr. Tadros' lovely house. Of course, we're here with Mr. Not Your Doc himself, Dr. Charles Tadros.
Hi, everybody.
It's a beautiful place. It's a beautiful setup that we've got here.
Thank you.
Yeah. And we can credit your wife with all the styling.
That's right.
Which
it
is excellent. She's got
100%.
some Easter stuff up in here. It looks
Thank you,
really
Julie.
nice.
Yes.
So we're back for another really interesting talk with another medical and mental health professional today. I'm so excited about this one. Dr. Jennifer Abel is someone that we've been wanting to have on the podcast really since its inception. You're one of the first people on our list that we wanted to reach out to. Your reputation precedes you, and I'm going to kick it right off to Dr. Tadros here to introduce you, and then we'll get going with our conversation about worry and anxiety today.
You're making me blush.
No, there's no blushing allowed. Well, it's good. Thank you, Vanessa. Jennifer, thank you for coming. It's you made time. We talked about this before you took off for a little bit, a month or a half ago. So I'm glad you made it. And then you were very kind. You caught up on some of your work, and then you came to see us here. I've known Dr. Abel for several years now, mainly because I was a primary care doctor in St. Louis, and I needed a lot of mental health professionals' help for a lot of my patients. And Jennifer happens to be one of those people that's very special. Not only is she bright and she writes books and she goes on speaking circuits, but she also returns people's calls. Other professionals.
Highly coveted skill.
It's rare. It's rare. I only invite people who call me back whenever I ask them about common patients. But I've known Jennifer for many years. Jennifer specializes now, and this is part of what I'm going to ask Jennifer to talk about. She specializes now in anxiety disorders and chronic worry and related, and we're going to talk more about that. So thank you, Jennifer, for making time. Welcome.
My pleasure. Good to be here.
Would you tell us a little bit about yourself, how you got to be a mental health professional, and a little bit more about the fun stuff that you like to talk about, some of the offshoots of just besides one-on-one patient care, client care.
Sure. Be happy to. So I started off in music school, of all things.
Me too.
Oh,
Yes.
really?
Love that.
Seth and I are odd guys out.
And I had tendinitis because I was playing so hard with so much intensity.
What was your instrument?
Piano.
Okay.
You too?
No,
No?
voice.
Oh, wow.
Yeah.
Cool. And I read this book about managing your stress and anxiety. And I learned progressive relaxation, which is, most people have done some form, tensing and relaxing your muscles. And I found that not only did it help me to relax when I was playing, that it helped me to relax in traffic and with obnoxious people. And so I became very interested in the mind-body connection. And decided to try psychology because I didn't want to eat, sleep, and breathe music. And fast forwarding into grad school, I continued down that road of really being interested in mind, body. And anxiety is where we see most of the physical manifestations of mental health, or at least in my view, with the GI symptoms, panic attacks, palpitations, tension, like I had, chronic tension that can lead to a lot of pain. And then I kind of stumbled into the worry part because I had the opportunity to do my postdoc with a guy by the name of Tom Borkovec. And he's one of the guys that wrote the book on that progressive relaxation.
Oh, okay.
So I was really enamored with his background, and he specializes in worry. And I love that I've landed on worry because worry is often the seed of many other mental health problems
Absolutely.
and physical problems.
That's right.
So, generalized anxiety disorder, which is the worry disorder, is one of the most common comorbid conditions amongst anxiety and mood disorders. And anxiety, the worry and GAD almost always comes first. So it appears to be a breeding ground
Interesting.
for, yeah.
Yeah, the pathology is.
And Vanessa and I have talked about this for years. I think that's one of the first things that we miss for the last 20 or 30 years. We picked up more ADD and ADHD, but I think, and depression. I think that's one of the things we miss in youngsters that eventually we see later is that the everything from generalized anxiety to social phobias to separation issues and panic, and that's what we eventually see as other mental health issues, just like you said, and physical symptoms. That's right.
Yeah, and I would even say that a lot of patients, clients, don't worry enough about their worry because they've worried all their lives
Right. Yeah.
and they just think, oh, I'm a worrier.
That's right.
You know, kind of like, oh,
That's right.
I have green eyes. And they think that they can't change it.
That's right.
And what brings them to treatment, sometimes it's, I worry too much.
Right.
But oftentimes what brings them to treatment is panic attacks,
It's
the
progressed-
depression,
It's progressed, right?
OCD. Yes, it's progressed.
Yeah, people need to
Or
understand that.
sleep problems.
That's
Yeah.
right. People need to understand, and this is exactly what I tell people, and it runs in my family too. They start out with generalized anxiety about tests or about running a race, and then eventually expands. They have a hard time leaving, getting on an airplane without having any drink or Xanax, and so it kind of expands. It never just stays where it is if you don't do something about it. You know? Yeah. Can you tell me what kind of how did you end up? Well, what's the difference between just a chronic worrier and excessive worrying and pathologic worrying and everyday just worrying? What's kind of the difference? Where do you differentiate it? When do you pat somebody on the head and say, "Hey, you're normal. This is not too bad for what you're going through. This is
Right.
acceptable. This is acceptable."
This is a reasonable response
Right.
here. Yeah.
This is not a quote from Yogi Berra. We were talking about baseball
Oh, yeah,
earlier.
sure.
But it sounds like it is. It's only a problem if it's a problem.
Okay.
Yeah.
If you find that you're not enjoying life, you find that you can't sleep, you have you're irritable, you have gastrointestinal issues, and as far as normal worry, 95% of people say that they worry, and most people that don't have a mental health condition worry about 5 to 10% of the time.
Interesting.
So if you're worrying 5, 10, even 15% of the time, and you aren't having any of those issues like you can't concentrate, can't sleep, GI issues, it's probably normal, average worrying. And most people who have generalized anxiety disorder worry about, on average, 50%. But I've seen people who are only worrying say they worry 25 or 30% of the time, but because it's at night and they can't sleep,
Sure.
Right.
they can't concentrate in their jobs, they're irritable with their family, they want help.
Absolutely.
I think I'm going to highlight a couple of things. Number one, that you think that you've said that some people just are warriors and they just kind of come to accept it, and that's just part of their life. And for you, and the implication here is that you don't have to accept it. That it's not normal to worry chronically all the time, even if you can still function around it or with it. You can get rid of this. You can decrease it enough.
Decrease it.
Okay, not to get rid of it.
Yeah,
And
I can often get rid of panic attacks, but
Okay.
not worry. And what I'm saying too is that if you have other comorbid conditions,
other mental health conditions,
other mental health conditions, or even sometimes physical conditions, worry may be more of a contributing factor than you realize.
It is. As an internist, it is 100% more problematic than you realize.
And super interesting is in a study that I was a protocol therapist on, treating people with GAD, their depression improved
absolutely.
significantly, even though we were not even allowed to talk to people about depression. And they even improved in the group that got relaxation only. And some meta-analysis, these studies that combine a bunch of studies, found that when you treat anxiety, depression improves every bit as much as if you treat depression directly.
Directly with the psychotherapy or cognitive behavioral.
Wild.
I love it.
It's. I think I'm going to highlight stuff. I know it sounds like it was like, well, I just said that, Chuck. Why are you repeating it? But I think I need to highlight. If I'm as an internist and somebody who prescribed and sent people to therapists all these years, I never talk about. We talk about this a lot. We don't talk about dramatic reduction, and we just help people barely hang on to dear life with their anxiety. But if we want to say, like you said, we can dramatically improve your life in terms of worry, maybe get rid of your panic, not necessarily with the pills. Also, we'll come back to talk about that. And that's all these things are a big deal. I think it's refreshing and rewarding to hear that that you can achieve that sometimes within weeks, months of your type of kind of cognitive behavioral techniques. Wonderful. It's fantastic.
Yeah, I saw a gentleman. Now, mostly this was him because he was really amazing and was a sponge. But I saw a gentleman one time, significantly better the next week.
Yeah.
Now, there's no guarantees.
Right.
Other people
Right.
may take several weeks or months. Or it might be that medication will help them more.
Yeah.
That's correct.
Before we move into kind of like the strategies that you use and some of the ideas that we're trying to knock down for people that are struggling with anxiety, can you talk a little bit about the uniqueness of your approach? I know our friend Dr. Larry Shapiro was on a couple podcasts ago, and he, like you, has a very practical sort of time-limited approach with very concrete and specific goals for patients, things that he wants to help them achieve, accessible tools, that kind of thing. And I know when we were talking earlier, you were sort of talking about, the first, second, and third session and sort of what you're hoping to achieve in some of those meetings with people. So what do you think is achievable, and what are some of those goals that you set out with when someone comes to you who you can identify as really struggling with worry or anxiety that may be exacerbating all these other issues?
And with Larry, we talked about PTSD. We didn't talk about anxiety specifically,
Sure.
but it's always impressive that these big diagnoses that absorb people's lives literally for years before they could see somebody like you, and you could turn them around in weeks to months. It's just dramatic, because I can't say that with pills and other things. Oftentimes, certainly not to the extent that I've seen what the results from your work.
And I would say too that there's kind of a reputation for therapy,
sure.
that it's this ongoing, interminable
Forever, right.
thing that you're always going to
Freudian.
go. Yeah, you're just going to go to the same person week after week and month after month for infinity years until you die, and you just go and regurgitate the things that you vent and the things that you're worried about. So I want to hear about the difference in your approach.
Supportive, and
Right.
absolutely, people need support. They want support, and that is always part of the therapy. And when there's a therapeutic connection, that helps a great deal.
Sure, absolutely.
But I have several different tools, and my approach depends on the individual. Last question of the questionnaire that I have them complete is, what do you hope to get out of this? And that's where I go. But in the very first session, I do some experiments. I have so many different things that can work. And part of the fun of doing this is guessing what's going to work with this person and experimenting. This road isn't working very well. What about this approach? And I like to do some experiential things where they can experience a difference during the session.
I'm going to tell you, this is like a foreign language to me.
Yeah.
I mean, I've known Jennifer for years. And once again, that's the problem with the physicians and is that I don't step into the room with you, with my client, or with our shared client to see what you do. I just see the results, and the client doesn't always describe everything to me. So I'm going to ask you to start from the basics, because you've written books, and I don't remember how many. One of the books has a number in the title. How many techniques? I don't know, some ridiculous number of techniques that you had. 90, I don't remember what it was. 50,
I don't remember the number.
Oh my
either.
gosh, she has like 57 cognitive behavioral techniques. I didn't know that there were that many. So I'm going to ask you to kind of backtrack, and so can you just take me through a typical patient, just a client coming in de novo to you, who's like middle-aged female who has chronic worry that's kind of progressed to the point it's caused sleep problems and other GI and other things like that, and people and becoming irritable. Just can you take me through a typical
first session.
First session, second session type of thing? Yeah.
I'm not sure there is a typical
That's fine.
session.
Good.
However, I do like to talk about there's several different things that can interfere with successful treatment.
Okay.
Number one is that anxiety occurs in a spiral of interactions between thoughts, images, physical sensations, behaviors, and emotions.
Okay.
Now, not every person has all 5 of those symptoms, but for each person, it follows a similar course each time.
Okay.
And it is either strengthened or at least maintained in memory. And what people typically do is they learn these relaxation strategies or other types of coping strategies. And so they might take 5 or 10 minutes to get deeply relaxed using a breathing strategy or mindfulness strategy. And then they wait until their anxiety's out of control and their spiral's too high. And then it doesn't work.
Right.
And then they get frustrated and they actually might start to feel hopeless that, this therapy isn't working. And I like to show people that we can get you very relaxed. Now, this may be more of a second session. I may be jumping ahead here. So I'll get them relaxed in the beginning of a session. And then I might I have a little, it's a little mindful bell. I forget what you even call it. And I'll just go. And when you hear that sound, that's a reminder to use your relaxation strategy without stopping the flow. So listeners right now could let go of any tension that they don't need in their body, just softening their muscles. They could use a breathing strategy that they've learned right now. They could be focusing on the surfaces beneath them. Like right now, I'm feeling the ground beneath my shoes and feet. I'm feeling the chair beneath my seat and my legs. I don't have to stop talking to do that.
Right.
And they don't have to stop listening to me to do that. They can do their jobs and do any of those strategies. Caveat is it's hard to do a breathing strategy when you're talking.
Sure.
Okay. So I can do any strategy I teach anybody right now while I'm doing this podcast. And it allows me to stay relaxed. So it's that ounce of prevention's worth a pound of cure idea that we see in medicine all the time, that we want to maintain that relaxation. So I may, use this several times, and there are apps that can do this. And I'm using this because we're talking on a podcast, but I might also hold up a sticky note and show them the sticky note. So when I'm doing this, using the surfaces, noticing the surfaces beneath you, or using your breathing to maintain that relaxation.
So what I'm hearing you say is that you're cueing people to engage in this relaxation and practice re-engaging in the relaxation through whatever it is that they're doing. does that help to ground
And-
people in the present
yes.
and in their
Yes.
bodies?
Yes.
So what impact does that have on anxiety?
So being in the present, you bring up a very good point that helps anxiety, and we can have several reminders. And I don't need to be the one having those reminders. They can put up sticky notes in their car, places they see frequently, places they associate with stress. They can change certain things on their phone, like the text tone, the ringtones, the wallpaper. So when they see that different wallpaper or hear that different text tone, that's a reminder for them to be in the moment. And I'm really glad you brought up the idea of being with, in the moment, because all worry is about the future.
yes.
And all regret is about the past.
Yeah, absolutely.
So when we're focusing on our senses, we are in the moment and we're free from that worry and regret. And it's easier to stay there than to get there from,
Yes.
your thoughts spinning.
Yeah. So kind of staying in that relaxation, does that sort of interrupt that anxiety spiral that you were talking about?
We hope that we prevent it
Okay, got it.
more than that we interrupt it. And when we aren't able to interrupt it and the anxiety is really high about the only thing that's going to work is acceptance
Yeah.
and drugs. And of course, drugs, they're negatively reinforcing. We find that, and I'm not down on drugs. I think a lot of medications are very, very helpful. And the data is that CBT works better than medication for all of the anxiety disorders except for social anxiety, which is about neck and neck. OCD is very, very close. But there's individual differences. So some people might do better with an SSRI or an SNRI than with therapy. For some people, if somebody's severely depressed, they're not going to be motivated to do these strategies, and they may require medication. I got off track there. So when the anxiety is high, one of the things that can help is acceptance. So, turns out that fighting anxiety fuels anxiety. And that's just foreign to everybody because we are taught to fight stuff that we want to go away.
Sure.
We're taught, almost all of us are taught that.
Right.
What? I'm supposed to surrender?
Yes.
So one of my favorites, and I'm not even a big Harry Potter fan, but the Devil's Snare from Harry Potter.
Okay.
I don't know if
Do
you've.
not.
So
not here.
if you
know.
check it out on YouTube,
Yeah.
they fall into this root system and they're wriggling and the roots are grasping them and tightening them.
Restricting.
And Hermione says, "This is Devil's Snare. You have to relax. If you don't, it'll only kill you faster."
Right.
And then, of course, Ron is like, "Kill us faster." And, he's
Yeah,
fighting
yeah.
it. Another analogy, I have several analogies, but
It's really true though.
but
Yeah.
when they stop fighting it,
Yeah.
This is
then
It relaxes
yeah.
and releases them.
Yeah, so it's just observing the discomfort in your body, allowing it to be there, letting go of fighting it, noticing what color it is it moving or still? If it increases, letting it increase. If it decreases. And that's not easy to do for everyone.
Yeah.
No.
It seems like one of the things that gets in the way of that acceptance is people feeling shame and guilt about their
That's true,
anxious
too.
reactions, right? Like I should be
That
able to
adds to
handle
it.
this better. I should be able to calm myself down. I should be able to think my way
Shooting
through
on
this or
themselves,
reason my way through this. So how do you help people overcome that kind of shame spiral in order to move into a place of acceptance?
That's a good question. The acceptance thing is usually experiential, but to say that this is natural, it's a natural response to want to fight this, and you're doing the best that you can.
Right.
It's not for lack of trying. You didn't get here because you're doing anything wrong or that it's your fault. And the good thing is you're taking responsibility by showing up and doing something about it.
Yeah, absolutely.
And I think another thing I use with that is think about if your friend, if your best friend or a close family member is having this. Are you going to tell them, you need to get over this?
Exactly.
You shouldn't be feeling this
Right.
way.
Yeah.
So treat yourself with the same kind of love and respect that you treat your good friends.
It's amazing how often we need another person's permission to have that kind of compassion on ourselves that we would, without thought, extend to anyone else around us. That's a pretty powerful idea.
True.
Yeah.
So you see typically a client with you. I know there's a big range. You say one session. Some people can have enough insight and obtain enough techniques from you that might be enough. Typically, do you have whenever you set goals? To get it started. Typically, your goals are for a client who has generalized anxiety or chronic worry. We'll not talk about panic or anything like that. Typically, what are you hopefully targeting in terms of seeing an effect, seeing a benefit versus it's time to graduate and you have enough tools now?
Yeah. Well, I look at their goals and how do they feel about where they are with those goals. So somebody comes in and they say, I want to stop worrying.
Right.
Like, well, that's not going to happen.
It's a little bit too general. Yeah.
And I say, even I worry. I don't worry very often. I shouldn't say not very often, but I don't worry very much. There are days I don't worry at all. There are days that I worry 10 or 15% of the days, of the time. And that's a normal amount of worry. And for instance, the person says, I'm worrying 75% of the time right now. How would you feel if you could get to 25%?
Right.
Yeah.
And then, hey, if we can get to 5 or 10, great.
Extra, yeah. So icing on the cake, right?
And I think the time that you conclude with therapy is when you see that they're comfortable with where they are, or they say, I can live with 20%, for instance, and it's been 3 weeks or 4 weeks in a row that they're kind of
right at 20%,
stabilized.
Do you do quantitative questionnaire or semi-quantitative whenever they enter the session versus whenever they leave or between sessions? How do you quantify 20% and 50%?
Really just self-report.
Okay.
And there is you caught me because it probably would be a good idea for me to use the Penn State Worry Questionnaire.
Is it okay? Now
because that's quantifiable.
Okay, now I'm writing that down because the rest of us need to.
And the Beck Depression Inventory, those are
So
good things
the BDI,
to yeah.
Or anxiety inventory. Is it the anxiety or depression inventory?
Penn State Worry Questionnaire, the State Trait Anxiety Inventory.
State trait,
Those are good measures.
Yeah.
I was better about using those when I was.
Well, you have experience now, and you kind of know it in your head.
You can gauge it more yourself.
Yeah, you already know it in your head. You incorporate it automatically. You're right.
But it is kind of nice to be able to say, hey, your Penn State Worry Questionnaire was.
Well, all the rest of us have EHRs, and they can push out to all these questionnaires and makes us feel better about ourselves and what we're doing. Because we don't, that's one of the, mental health is one of the places we don't quantify enough. I check blood pressure, I check sugars, I check waist size, I checked all sorts of stuff, weights, but I don't check, other than qualitatively, what a patient tells me, client tells me about their mood or anxiety.
Well, it's difficult to quantify those things, so that makes sense too.
I want to get back though to you were talking about shame, and a lot of people feel ashamed of expressing their emotions, and Chuck and I have talked about this before. Dr. Tadros and I have talked about this before.
Chuck, my Latin teacher called me Chuck. It's all right.
And there's a lot of really great evidence now that when we express our emotions, it's really beneficial. And when someone is stuck and these strategies aren't working, then I look to what emotions are locked in.
Yeah.
And helping people to get comfortable with being uncomfortable, getting comfortable crying, comfortable getting angry, as long as it's not hurting anyone.
Right.
And so many people feel ashamed to cry or ashamed to express their anger. And of course, you want to express anger in a way that's not destructive.
Sure.
Right.
Do you see a lot of fear in people that if I express my emotion, if I feel my emotion, I'm going to start crying and never ever be able to stop, or start yelling and never ever be able to stop, or break a window or something like that. So when you see that fear come up in people, how do you help them disarm that fear and get comfortable with just feeling the emotion?
Not always easy, but what I usually do is take it back to a memory and have them experience that memory and talk to them as if I'm there. And rather than saying you have to cry or you have to get angry, and it it happens, rather than saying you need to get angry or you need to let yourself cry. But sometimes I talk to them about the data that is showing that when you express there's one study, I mentioned a study that I was a protocol therapist on, and in that study, people who felt comfortable expressing their emotions improved significantly more than people who held their emotions in. And there was another study at Penn State as well that Louis Castonguay looked at people who did more emotional experiencing during the course of treatment for depression were much happier at the end of the session, at the end of the study. However you can get there. There's so many different avenues to getting there, but people who think that it's healthy to be stoic
have a lot
mistaken.
of problems. Yeah, absolutely. Yeah. I was just going to ask you about that. How often someone coming in with excessive worry or chronic, physically manifesting anxiety are also poorly in tune with their own emotions and also maybe not skilled at regulating those emotions.
Yeah, they call it alexithymia, away from emotions. And there's also been some studies that they don't do well. Those who don't regulate those that aren't comfortable, have a hard time identifying them. There's actually a child's book called How Are You Peeling?
Yeah.
Have you seen that?
I've seen lots of child emotions book recently.
and it's kind of funny because it has these different fruits and vegetables that
Very
have
cool.
different faces and
Absolutely.
I've used that before to help people to identify what they're feeling.
It's kind of funny because you think, being able to identify how you're feeling should just be such an intuitive thing. But what a skill. It's a learned skill. No one comes out of the womb. No one, you don't take a class in high school or college about naming emotions, specifically identifying emotions, specifically identifying physical sensations that are tied to those emotions. So talk about that the importance of that.
Yeah. And it's like you read my mind. She's a psychic and I'm a psychologist, and you're almost a psychiatrist.
No, not even close. Not even close. But I need to learn. All I know is I need to learn a lot. I need to see a lot and do a lot and learn a lot. But anyway,
So you said the physical sensations, that's where some people who can't identify.
They can't. That's right.
That, I'm feeling sad or I'm feeling angry. When you're talking about this, where are you noticing it in your body? Oh, my teeth are clenched.
Right.
I'm feeling my jaw tight.
Right.
I feel a heaviness in my chest. I feel a pit in my stomach. what would happen if you just allowed yourself to continue to feel that?
So it seems like a big problem is that discomfort, that feeling of discomfort comes over somebody, and they want to just reject it. I got to get rid of it as soon as possible. I have no tolerance for this. So whether that's taking a drink of alcohol or drugs
fast.
or something quick, easy, immediate.
Go to bed, something, yeah.
Yeah, so what an incredible and important skill it is to be able to say, okay, my chest feels tight, my breathing is more rapid, I'm feeling sweaty. Okay, let me tolerate this for a few minutes and see if I can allow it to happen to me and sort of excuse it, accept that it's happening, and then sort of move on.
Yep.
And not accepting it and fighting it is what often leads to those panic attacks.
Yes.
And while you were talking about that, I was thinking how wonderful it is that there are so many athletes and musicians and
stage
actors
fright
that
and everything
that
else.
are talking about
Right.
Michael Phelps.
That's right.
Was one of the first athletes that you heard, and then Simone Biles. And it's wonderful that they're kind of making it okay.
All right.
And for people to say, hey, it's okay to not be okay.
Right.
And that helps to make it more temporary because you can get help for it.
That's
You
right.
don't have to be as ashamed. I think that they help to take a lot of the shame out of it because they think, oh, if this person that I admire has had that,
Sure.
it's okay for me.
We talked about men in abusive relationships and and whenever I sat in on some sessions many years ago, 28 years ago, they had on the wall, this is for all men who were abusers in relationships, they had on walls feeling statements.
Yeah.
Because they had to actually write it on a wall. Because guys just were not in touch with their feelings, their physical symptoms. All they just quiet blow up, and they literally don't have words. They don't have words to describe what they're feeling. They don't have words to describe what their physical sensations are. And you're right, it's Vanessa. It's nothing. It's just we live in families where this is kind of represented. Nobody talks about their feelings.
True.
It's not like you have to talk about it all the time. It's not like you have to wallow in it. But to kind of understand that's where it's coming from, and it's not nobody's fault, but for you to be able to understand it better. Name it.
Sure, and a lot of times there's a lot of correction
Right.
and pressure within families and communities to not be emotional, right?
Right.
That showing anger, or showing fear, or showing sadness is, oh, don't feel that way,
Right.
or you don't have to cry, it's not that bad,
You negate it,
or
right? Somebody negates it right away.
exactly. And so then it becomes socially unacceptable to express those things about yourself. So then it's an adaptation that you have to your environment to just get along through life
Right.
by ignoring your emotions or not paying attention to what's really going on there.
Can you
Manifest in so many ways.
I'd mentioned to Jennifer cognitive rigidity and kind of this emotional regulation or dysregulation. I hear it in a bunch of different mental health conditions, but I certainly when I was trained, cognitive rigidity we tended to see in kind of a cingulate, kind of an OCD type person. But I think I see it probably in a lot of other mental health issues. Can you? About cognitive rigidity, I mean, once I know something's right, I should stick by my guns, shouldn't I? I mean, why do I have to be? Why do I have to be flexible? I know what's right. I'm the guy. I'm the husband. I'm the dad. I'm winking. I'm the doc. I'm winking at everybody around the table. So why do I have to be cognitively flexible? And what does that mean? Does it mean I give up my values? Because I'm just dragging Jennifer into the mud because I want to make sure that we stretch her abilities here.
We get her for the good stuff.
Yeah, that's right.
That kind of threw me a curveball
That's
there. Right. I guess I would approach that. What are the advantages of thinking this way?
Right.
What are the disadvantages of thinking that way? What are some alternative ways that you could think?
Anything that, as long as what my wife and my kids want, then I don't want it automatically. My way is the right way. But, it's not that people are bad or mean. It's just that very narrow. I don't have exposure to a lot of other things, and that's kind of the way it worked and blah, blah, blah. But you're right. It comes at a great expense. That's why I'm bringing it up, obviously.
Yeah.
It comes at severe expense.
And in that situation, I've done some stuff that's not really cognitive behavioral, but to said, like for you to visualize that you are your wife. And you've got those heels on, and you've got that, whatever she wears, and you're hearing your voice saying, "Hey, it's my way," and trying to be put in that position and see what it's like.
Shoe on the other foot.
Exactly. Yeah, the shoe on the other foot.
And then the emotional regulation, dysregulation. I think part of it emotional. People think being emotional, in public, but for me, part of it's to stuff the emotion, kind of suppress it.
Right.
There are some advantages because you can kind of get through the moment.
Yeah.
But it comes.
And there
it
are
comes
times
out,
that it's
right.
not appropriate.
It's not appropriate. But unfortunately, it's kind of like a coach or a police officer. It's hard not to be that at home, right? What you do for your job and what makes you successful, hard-nosed attorney, whatever it is, maybe doesn't work well in other relationships in your life. So that kind of that cognitive rigidity and then that inflexibility emotionally, and so when is it appropriate? I mean, should there be catharsis once a day? Kind of sit down, journal, meditate. Well, how do you let go? How do you have that emotional regulation?
Yeah, when I think of emotional regulation, I think about what is the response that anybody would have.
Right.
So if you have a dog and you live in a quiet cul-de-sac and an electric fence in the front yard, and somebody comes flying through the subdivision 50 miles an hour, 55 miles an hour, hits your dog, kills your dog, what are the two emotions you're going to have?
Rage and sadness.
Yeah. Sad, right.
And people might use different words for that, but it's basically offshoot of rage, anger, infuriated, pissed off. It's the same thing, or, that and sad.
Grief.
Yeah. And those are the emotions that we want to accept.
Right.
But as Charles was saying, it's not always appropriate.
Right.
If you're in a meeting, it may not be appropriate to break down in tears or to yell at your boss, and it might cost you your job. So you can postpone those emotions so that you don't react when it's inappropriate, so that you have an appropriate response.
Right.
And I've just heard this: you want to have a response rather than a reaction.
Okay. Yeah.
But that the response implies you're holding back a little bit. But if you can react so let's say you do have a problem with your boss. You're really angry at your boss. Of course, it's not going to behoove you to yell at your boss.
Right.
But what you can do is write an angry letter you don't send.
Yeah, absolutely.
Visualize the boss in an empty chair and yell at the boss in the empty chair. Get it all out. People who are really angry about political issues, to visualize in the open chair if it's something that they're really passionate about, to just get it out so that and it's healthy to vent that, so that they don't do it when they're in that situation and they lose their job.
And that actually works. I think people say that sounds silly, but actually this is the problem is that we don't try the simple stuff first, and it can work. Certainly, and that's a big deal.
I think a thing that I hear you saying there too is that we want to have a proportionate response, right? We want our emotional response to be in proportion to the the real thing that's triggering that emotional response, right?
Mm-hmm.
So I think that's part of, again, back to that fear that people have of expressing their emotion.
Yeah, that they'll never stop.
Exactly. That they're, maybe they have felt that way before, that, I've gone to this place in the past and I felt so helpless, or I felt like I was going to dissolve into a puddle, that feels very scary. But then also at the same time, I think just personally, at times when I've been struggling really badly with my mental health, I have felt like my emotional reactions were disproportionate to the things that was triggering them, and it was extremely distressing for me.
And sometimes when that happens, their emotions are about their emotions.
Yes,
Yeah,
that's right.
I'm crying because I'm crying.
Yes.
And that's where that if you accept that crying,
Right.
I've had a handful of people who have said, I just start crying and I keep crying and there's no reason that I should be crying. And I don't know what, it's like, next time, just think, okay, cry harder. And it almost always works. But one of the reasons that before I get people to that emotional place, I give them more skills.
Yeah.
So that they have skills to treat this. And I came up with this phrase, visit it, don't live in it. You want to visit that emotion.
Right.
You don't want to live in that
Right.
emotion. And you can, and with the fear that it's never going to stop, I think the more that people have skills to manage their anxiety and manage their grief, including allowing themselves to feel it, the less likely it is that that's going to go on
Right.
forever.
Yeah.
Yeah.
You
That's a
know,
good point.
And the reality too is that almost no one is ever stuck in an emotion that way forever.
exactly,
Like,
and that
it doesn't happen.
Yeah.
Yeah.
And I'll even say, well, let's do an experiment. And next time you feel like crying, let yourself cry, and time it.
Yeah.
And see what happens, because there's never been anybody who's started crying and stopped and hasn't been able to stop crying.
Right.
There's never anybody who's done an open chair and didn't lose steam for getting angry.
Sure.
And so I just that it's not an uncommon fear, but it's never happened.
Right.
But if you accept the emotions you're feeling, it's going to be much shorter.
Right.
Because otherwise you get into these, what Marshall Linehan calls secondary emotions, where you have the emotions about the emotions. Then, so the person who yells at the guy for running over their dog and starts crying on the front lawn, if they accept that they yelled at the guy and they cried, they're processing what happened. They process the event, and it eases it. But people who are like, oh, I'm so embarrassed that I cried. I'm ashamed that I yelled at the guy. I feel so guilty that I yelled at. Now I'm really depressed. And then the focus is on those emotions about the emotions.
Secondary, yeah.
So.
Yeah, Marshall Linehan is the inventor of dialectical behavioral therapy.
Right, very good.
Yeah. So, and do you subscribe? I mean, Vanessa and I have talked about this because when we see patients that come to a ketamine clinic, a lot of them need a lot more tools, whether it's cognitive behavioral, which is a classic way of reframing and giving you more tools to reframe and to reprocess it differently, but also dialectical behavior. Do you subscribe to some of the dialectical, whatever works?
Oh, absolutely. Absolutely do dialectical behavioral therapy, which includes mindfulness.
Right, yes. Mindfulness is a key piece of it, yes.
Yeah, and we got off on this tangent about the emotion stuff, which is fine, but I think it is important to get back to one of the first questions, which is, what are some of the skills that you want to learn?
Yes, yeah.
And there's a couple of experiential things that I do with people.
Yeah, this is something important because and once again, I'd like for you to talk a little bit about your books and some of your speaking circuits, because you spoke for quite a while and then came back to practice. But would you, can you tell us some of the techniques and experiential pieces of the techniques?
Okay. So I invite listeners and you in the room, gently closing your eyes and noticing how you feel when I say these words. Calm down. Calming. Calm. Calm. Calming. Calm down. You can open your eyes. Anyone ever tell you to calm down? You want to flip them
Yeah,
I
off?
was just going to say,
Or
calm
they
down
tell
makes
you,
me angry.
or they tell you relax,
Yes.
and you get more anxious or
Sure.
more frustrated
More angry, sure.
because they're commands.
Right.
And not only do other people shout out these commands to us, we tell ourselves.
Right.
We tell ourselves, chill out, calm down, let it go. And that makes it even harder to let it go. So I'll help people, I'll walk them through. I said, well, what works best for you? Is it calming or calm? And if
Yes.
it's calming, that's a process word. Then
Right.
I'll go through 3 more. Releasing, relaxing, letting go. And then 3 more. Soothing, chilling, freeing, and loosening. And then,
Right.
so I get the best of the first 3, best of the second 3, best of the third 3, and then try those 3, and then that's their process work.
Love that.
And then that's something that when you see that sticky note or you hear that text tone, mine is soft or softening. That's my favorite. And then I say, when you see someone else is anxious, use your word. Soft, peaceful, letting go, whatever it is. And ask people with whom you spend a lot of time, instead of telling me to chill out,
Right.
can you please say soothing?
Yeah.
Very super simple thing.
They are.
But it can really change. It can really make a big change for someone. Just
Absolutely.
that very simple thing.
I have to go take a nap now because just listening to you I feel a little hypnotized. No, but actually it's interesting how small these techniques are, but how important they are. You'd like to think that it has to be something dramatic and big, but but you're telling me it's not. In fact, and you've done it for many years.
Yeah.
Can you tell us a little more about generalized? When does generalized anxiety and worry start? I tend to see it in kids. When I hear about it as adults, when we take them back with their adult eyes and adult ears, they see it as children, oftentimes because of distress in the family and other things like that. How do you don't take care of youngsters typically?
I don't.
Yeah,
I don't.
When does it matter when it started? How many years it's been going on? If it's attached with worry and anxiety with trauma or perceived trauma, does it make a difference for you, or is still your techniques and approach is still the same?
If there's trauma, I'm not a trauma specialist,
Right.
and
Yes.
in this great city, there's so many people who are more
Yes.
specialized in
Yes.
trauma than I, and I'm a huge believer in specialization and that, hey, I know this person who works with
Right.
trauma, or that person
Right.
that works with trauma. However, we've all experienced trauma
Some
in
level,
our
that's correct.
lives
Right.
to some degree.
That's correct.
And I do something called schema therapy for those that have that moderate level of trauma. But I think, by and large, the anxiety piece, the worry piece, I probably do the same thing, except that I would add that part that we were talking about before, finding a way to unlock the emotion.
Gotcha.
What do people worry about? What kinds of things do people worry about?
money.
Let's include everybody now.
Money, their children, their job, what people think of them, the future.
Their health.
The health, yes. Yeah.
Yeah.
You would have to bring that up.
No, well, that's fine. Well, no, but it's universal. I mean, these are also stressful things. Whenever whenever you look at stress indices, it's money and family and children. It's the top three. Changing jobs, losing jobs. It's the top 3, 4, 5. It's the same thing. That's exactly right. Yeah.
Yeah, and I saw in this question, why do people worry?
Yeah. Yeah.
Why do we worry?
Yeah. Why? I mean, is there a biological advantage? I mean, does it keep us vigilant? Does it protect us from the anticipatory stuff, the anticipation of bad things happening? Does it protect us from them? Do we catch them earlier and act on them? Yeah. So that's a big deal.
It's actually likely to do the exact opposite, if anything.
Yeah.
Okay. Because worry is useless. Problem solving and planning are useful.
Okay.
We can plan and problem solve with or without anxiety. We've known for a long time that people with generalized anxiety disorder don't tend to problem solve well.
So that's a big deal.
But a guy by the name of Michel Degas found out that people who have generalized anxiety disorder are just as good at problem solving as anybody else, but the anxiety kind of handcuffs them.
Yeah,
Keeps them from seeing the alternative. And everybody listening here today has experienced this.
Well, sure.
Where
choke,
where
whatever,
you know
right?
you don't come up with the solutions from worrying harder and longer.
Right, exactly.
When do you come up with the solutions?
After a nap.
The shower,
When you're
the shower in
fresh.
the morning.
You're taking a shower. Yeah. When you've let it go, then you're like,
Yeah.
I can do this. So one of the things that I encourage people to do is use some relaxation and observe their thoughts. Sometimes, that whole fighting anxiety fuels it. If we're observing, awareness cures trying fails sometimes. That if you're just aware and you're just observing these thoughts, that, and one of the things that I do is have people label their thoughts as helpful and not helpful, or useful and not useful. And I use that because what often happens is that when people say useless, 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 they feel the futility of those useless thoughts in a way that they haven't thought of them before.
Sure.
And it helps them to automatically let go. But then I was using with a woman about, probably 20 years ago, and she kept saying, helpful, helpful, helpful. And she opened her eyes and she said, oh my gosh, I know what I'm going to do now. I don't even feel anxious anymore because I've come up with these solutions.
Right. Yeah.
But she had to give herself the permission to think about it, or I gave her the permission. She allowed herself the permission. And
I think something that's so interesting about that idea is that helpful and unhelpful are qualitative words, right? They're kind of like value statements, but we're assigning them to the thought, not to ourselves as a person. Like, I am not an unhelpful person. The fact that I am thinking is not unhelpful, but these are the contents of my thoughts. These are the flow of my thoughts or whatever, which kind of removes that identity piece. It kind of puts some distance there. So I don't have to be caught up in how bad I feel about myself for having these ruminating thoughts, but I can start to sift through them in a way that produces something.
Yeah. And what I actually start with most of the time is having them say new and repeat. Every thought that you think is either a new thought or a repeat thought.
Wow,
and with worry, it's usually repeat.
Right.
They go repeat. They feel the futility of those repetitive thoughts, with less likelihood even than to judge the thoughts as helpful. Because some people will go like, oh, there's another unhelpful thought.
Exactly.
So
that makes sense.
but don't worry, problem solve. So I think a lot of times people are trying to solve a problem, as you implied, but they're actually less likely
they're just pedaling fast and going nowhere, and getting exhausted. That's what we see physically, is they become exhausted.
Yeah, lots of other reasons to worry, but I've seen we're out of time.
Yeah, it's relative. Time is relative.
Absolutely. I think, we love to sort of end these conversations in a place of hopefulness and a place of action. So obviously, if a listener is not themselves experiencing anxiety or worry, surely they love someone or know someone who is dealing with a lot of anxiety or worry. So what advice do you have to families and people who care, friends, people who care about anxious, worried people? How can we best be supportive of each other during those times?
Allow them to talk about their worry, because the worst thing you can say is don't worry about it.
Right.
And I could talk about all the research, but that's going to actually make them be more likely to worry about it if you tell them don't worry about it.
Yeah.
And people just want to be understood. And I think that when we let go of judgment, we open our hearts to compassion.
Absolutely.
And using those words, like if you have a tendency to tell people, just breathe, instead, breathing. If you have a tendency to say, calm down, instead, calming.
Right.
And a lot of people, depending on how well you know them, touching their shoulder or touching their forearm or their knee, depending on how well you just say, breathing.
Right.
Letting go.
Right. Just like we wouldn't demand something. We don't want to demand an action from someone else. We don't want to demand an action from ourselves, focusing on the process of doing those things. I love it.
And it might be that they sit down and say, let's think about what we can do about this.
Sure.
Because I've had a couple of clients who I talked about, well, what can you do about it? And they came back and they said, every time I started to worry, I thought, well, what can I do about it? And if there was something I could do about it, I made a plan. And if there wasn't, I realized it's not worth worrying about.
Right.
Yeah.
So, let's see what we, maybe as a supportive role, is to say, let's see if there's some things that we can sit down and talk about that we can do about this to make things better. What are your options?
Yeah. That's such good relationship wisdom right there, is to sort of differentiate. Do you want me to just listen to how you're feeling, or do you want me to help you solve a problem?
Yeah.
And sometimes it's both.
Yeah.
Or sometimes it's one first and then the other.
Right. Be listened to first.
Yeah, that's one of those Mars-Venus things that they say that men want to solve the problem and women want to, but it's not always that way.
No,
It's not always that way,
It's
no.
not,
Yeah,
But being
I
able to
always want
differentiate
both.
as well. Yeah, there we go.
I'm greedy.
Exactly.
I want people to understand what I'm feeling and offer some solutions for
Right.
me.
Absolutely.
Well, thank you. There's always more, and I think we have more strings, more ends of strings that we can, kind of roll out and talk about for another hour each. I still want to talk about your speaking circuit and about your books, and so we ask you to come back sometime.
Sure.
Is that okay?
Sure.
We could do it a bunch of different ways, and there's other expertise that you have, and because you've had long experience, and thank you for being here in the St. Louis area. Thank you for writing books so people outside of your earshot can learn some of your techniques and basic stuff that the rest of us kind of gloss over and just go straight to pills and other heavy duty stuff. So I really appreciate kind of grounding me and saying, hey, backtrack a little bit, Chuck. So,
This is the stuff that really impacts people's lives on a
Absolutely.
day-to-day basis.
Absolutely.
We see the impact of great therapy on our
Yeah.
patients all the
Right.
time at Midwest Institute for Hearts and Minds. So
absolutely.
thank you so much for being here
Yeah.
today, Dr. Jennifer
Thanks for
Abel.
having me,
Thanks, Jen.
Vanessa and Dr. Tadros.
Yeah, welcome.
All right. Well, that is our show for today, folks. Of course, if you want to get involved in the pod, you can send us your feedback. We're always available by email, notyourdocpod@gmail.com. We'd love your feedback, any questions that you might have for Dr. Abel. You can check us out on our website, of course, notyourdoc.com. We've got links there to Dr. Tadros's blog, also to all of the podcast episodes. You can find us on YouTube and Spotify as well. And we're going to be back again next time for another great chat. I'm Vanessa, again, here for Dr. Tadros, Dr. Jennifer Abel, and Seth. Thanks,
you.
everybody.
Thank you.
All right, bye-bye. This previous podcast represents my opinions and the opinions of my guests. This is not medical advice, and I'm not establishing a physician-patient relationship with any listener. The content here should not be taken as medical advice. The content here is for informational purposes only, and because each patient is so unique, please consult your healthcare professional for any medical questions that you may have.